right, folks, welcome. And my name is Steve Gurney. Thank you for being guinea pigs on a new way to sort of connect and communicate with each other online. Um, I'm the founder of Positive Aging Sourcebook and the Positive Aging Community. And if you have attended any of our events over the last 2 years, you know we use this platform Remo every now and then for conferences and things of that nature, and mostly use Zoom because it's technically a little bit easier than this platform. But the only way we're going to get used to working in a various platform is by using it more. And so today is the first test of a format that we'd like to propose where we're going to have a presentation on a specific topic, which is early stage Alzheimer's. And then we're going to have a little networking and resource fair associated with memory care resources. And let me share my screen before I bring up Lindsay, because I want to familiarize you with sort of this platform and how it works. So what you just left was Floorplan Mode, which you can see on the screen there that I'm showing you. And in Floorplan Mode, I want you to think about you're attending an event just like you did in the good old days. You come into this big conference room and you can go and sit at any table that there's a chair open, and you can talk to the people who are at those tables. Now, you'll notice that some of the tables have names of organizations: Insight Memory Care, Silverado, Friends Club, the Virginian Memory Care, Potomac Place, Tall Oaks, Charles E. Smith Community, Ingleside, Great Falls Assisted Living, the Providence, Arbor Terrace, Counterpoint and DCAT, Rembrandt Assisted Living, Inspirations Memory Care. There's a representative at those tables from those various organizations. So after we have our discussion on early stage Alzheimer's, I urge you to go back and meet some of these people if you're interested in learning more about their services or just connecting. And then all the other remaining tables that are numbered, just jump on a table there and connect with folks. You may meet some senior living providers. You may meet other families and individuals that are dealing with memory care challenges in their lives. And we hope you enjoy this platform, and we hope that it makes it'll never be a replacement for us meeting in person where we can give each other a big hug. But none of us had to get into a car today to attend, and that's kind of nice. I'd also on the screen here before we jump off, and I'll bring this up before we go back to floor plan. Over on the left-hand side, you see there's some offices, and there's an office there just for Lindsay Vajpeyi, who is our presenter today. So after the event, if you want to go chat with Lindsay about anything that she was talking about, jump on in that office, and or feel free to occupy any of the other offices to network. So let me take my whoops. Oh, no. I am going to take my screen off. And now what I want to do is bring Lindsay to the stage. And so I'm prompting Lindsay, who is our speaker today, who's going to talk about early stage Alzheimer's challenges. And then at the end of this, we will go back to the floor plan and let you all connect and network. So Lindsay, can you hear me? And how you doing today?
I can hear you, Steve. Great to see you online. And I'm seeing so many great comments in the chat about people loving this platform. So thank you for making this opportunity available for all of us.
Yeah, and I will just tell you all that as much as probably 90% of the room is enjoying the platform, I'm going to say as much as 10% of the room might be challenged or frustrated by it. Hang with us, folks. Anytime, I remember back 2 years ago, we were all having a difficulty navigating Zoom, and now we just do it like that. And this will be the same experience, I promise you, and actually better, I think. So Lindsay, one of the reasons that I wanted to try this out with you first is because Insight Memory Care actually used this platform for the last 2 years for one of your big events, which I hope you talk about. But before we jump into the discussion and learn more about you, or learn more about Insight, tell us a little bit about your career path and what led you to the role that you have now in working at Insight with early stage Alzheimer's families.
Sure. Well, thank you for inviting me to be here today, Steve. And Steve, you said my name correctly. So all of you who are seeing the spelling of my name, wondering how to say it, Steve got it right on the first try. You're one of the only people who do that.
It took me 2 years, so
we've known each other a while.
Yeah.
So I'm Lindsay from a nonprofit organization called Insight Memory Care Center, and I've been with Insight for about 4.5 years, and I'm loving it and love the mission that Insight serves in the community, and just feel just really strongly pulled towards this organization and all that it does. But before this, kind of what led me here. After college, I didn't know what I wanted to do with my life, but I did an internship for my gender studies degree at a retirement community. It was in it was in Iowa actually, but it was a lot like Goodwin House, for those of you who know Goodwin House, where there are these many levels of care. So that kind of got me into the senior care side of things, which led to a position in Minneapolis in an activity department where my office was on the memory care floor. So that was really my first experience in direct memory care, and I found that I loved it. I loved it. I also worked in other parts of the building, in rehab, long-term care, assisted living, but I really loved every time I was assigned to the memory care floor. And that led into some staff education after being there for many years and working with an interdisciplinary team, working with families, and then moving out to the DC area to be at the Alzheimer's Association for a few years, and then to Insight. So I've recently shifted positions at Insight, where I used to focus on education and support. I focus a bit more on supporting early stage families now. So I've just really enjoyed kind of this trajectory that my career is taking. And I love, the thing I love the most is working with families and getting to make any kind of positive impact that I can in their lives.
Great. So this is, and so Lindsay and I are going to have a discussion on stage here about challenges and solutions for early stage families. And we want you in the audience to participate. So if you notice, there is a tab that says Q&A. It's probably best to type your questions in there, because it's hard for us to see all this great activity that's going on in chat. We'll do our best to sort out questions and comments that are there in chat, but if you type something into Q&A, that'll come to both of our attentions much quicker. So, but I'm glad you said, your passion is working with the families, because that's where I'd like to start. I can't tell you how many, at least 2 or 3 times a week, I'm getting a phone call from somebody that had a copy of source book, and their question is, it's sort of like, I think Dad's got Alzheimer's. That's usually what they say is, I think Dad has Alzheimer's. He forgot his keys. He doesn't, like these various things. And I point them in the direction of the Alzheimer's Association and Insight Memory Care. We've got actually a pretty cool organization that's on the floor called Counterpoint and BCAT. I've been pointing them in that direction, or care managers. What do you share with people that think that mom and dad have some form of dementia?
Yeah, I actually got that call. I get that call all the time too. Yesterday, I had a voicemail in the afternoon saying, I'm concerned about my mother-in-law. We think that something is going on. She obviously has this memory loss that doesn't seem typical of how she used to be. And so we don't know what to do next. So can you call us back and help us out? And there is a difference between normal aging and dementia. And there's also kind of this middle of the road that we call mild cognitive impairment. And so how do you know if your loved one, or maybe for those of you who are professionals out there, how do you know if your client is experiencing a memory impairment? I mean, we all do experience some cognitive changes with age, but sometimes those changes get to a point that they're starting to become much more apparent to people around them. Like it's different than how they used to be. It's different than their baseline. And sometimes it reaches a point when we call it dementia, and that means that it's really interfering with daily life. Things that someone used to be able to do on their own, they can no longer do. So think about like cooking a dinner or paying bills independently or driving and shopping and doing things like that. And when we start to see somebody that we know well who has maybe short-term memory loss, is repeating the same questions over and over again, telling you the same story over and over again, having difficulties with some of these sort of tasks of daily life, these could be red flags that something is going on that's not normal for aging. And when you know the person well, you know if it's not normal for them. And so what my suggestions, I sort of talk through this with families, some of these common warning signs, trying to learn more from families about what they're seeing and experiencing. But really, then the next step is to see the doctor, because there's a lot of reasons why someone might experience changes with their cognition at any age, but especially in older years. And it's not always related to a progressive disease like Alzheimer's. Sometimes it's related to a thyroid condition, a medication side effect. Maybe it's a brain tumor. There's a lot of other things that could be going on. So the first stop is really that primary care doctor, which eventually might lead to a referral to a neurologist.
Great. And because I know we've got a lot of providers in the audience, but our discussions have been bringing a lot more families to the table, which I'm delighted. Let's kind of take a step back and sort of define the different levels of cognitive impairment, what we call dementia, early stage Alzheimer's, what have you.
Yes. So the question I get asked probably most often is, what's the difference between Alzheimer's disease and dementia? And dementia is just a very general word that we use to describe symptoms where there are changes in cognition that are more severe than what would be considered normal for the person's age. And they're severe enough that they're interfering with daily life. So these are not just kind of flukes that happen once in a while. They're not just minor annoyances. They're truly things happening that are getting in the way of that person living safely, independently, making sound decisions, caring for themselves totally independently. So dementia is a very general word to describe symptoms, and there are many diseases that fall into that category. And Alzheimer's is the most common form of dementia. So about 60 to 80% of people who have dementia have the Alzheimer's type, like that specific disease. But there are a number of other types of dementia as well that are typically a bit lesser well known. So Lewy body dementia, vascular dementia, FTD, and others. So today, the title of our presentation is to talk a little bit more about Alzheimer's disease. And when we talk about Alzheimer's, we tend to then refer a lot to memory loss. But I just want to point out here that for other forms of dementia, like Lewy body or FTD, memory loss may not be one of those first warning signs. This may not be one of your more pressing concerns early on in the disease process. Great. And then I guess I'll also mention the MCI, mild cognitive impairment. So that's kind of like the middle road between normal aging and dementia. Mild cognitive impairment means there has been a cognitive change that is noticeable by others, is identifiable on testing, but it's not yet interfering with daily life. So the person is still able to do the things that they always were able to do. It might take a little bit longer. That person might be a little bit less efficient, but they're still able to complete the tasks. And research shows us that each year, about 10 to 15% of people with MCI end up moving forward into dementia, get diagnosed with dementia. So not everyone with MCI will develop dementia, but it is commonly, that's part of the trajectory. Like if somebody has Alzheimer's disease, there are things happening in the brain before there are ever any symptoms. Then we start seeing some symptoms, that's MCI, And then eventually those symptoms become so prominent that they get in the way of everyday life. And that's when we reach the stage that we would call dementia.
Great. Well, again, our audience never disappoints. So let's attack some of the questions that our audience members are throwing to us. And I love this one. And I love the fact that we're in this format on this one, Lindsay, which says, what are free or low cost resources for family caregivers if their mom with dementia doesn't have insurance? And I'll pose that question to you. But this is a fantastic thing for many of our audience members and resources to type in resources for this person who's seeking these solutions in chat. Okay. So any thoughts on low cost resources? I guess one of the first one is the services that the Alzheimer's Association provides are relatively, for the most part, free of charge, correct?
Yes. So there are a variety of different kinds of services, and it depends sort of what you're looking for. So free and low cost services, like at Insight, we provide consultations free of charge to anybody, anywhere, as often as you want, and there's never a charge for that. Alzheimer's Association also does. ElderLink, which is located here in Northern Virginia, does 1-hour consultations at no charge. So that's one way to access at least some information, learn about some resources at no charge. Support groups tend to be free and open to the public through most organizations, including through Insight. So that's a service for family caregivers. Now, for the person living with dementia who may need some support, may need care, some of your free or lower cost options might include some of the day programs in the area. So through the county government, like in Fairfax County, there are 4-day programs. Arlington, there's one. Alexandria, there's one. And there are others around the DC metro area. Those tend to operate on like a sliding scale. So that might be an affordable option for some families to receive some care during the day. And at Insight, we are not part of the county government. We're our own nonprofit organization. So our fees look different than through the county government. But for example, we have a financial assistance fund, and other organizations may also have scholarship or financial assistance funds to offer some care to people who may not be able to afford other services. Also new to this area, if you're in that Alexandria area, is the Cherry Blossom PACE program. And so that's a program that provides all-inclusive care for the elderly. So most people enrolled in that program are duly eligible for Medicare and Medicaid. So there are, that's just a small example of some of the services in the area, but there are resources available. And I do encourage you kind of throughout this presentation and even when you're in the memory care fair, just start asking questions. You know, when a family calls me, they may call with one very specific question, but once we start talking, we realize that there's a bigger story here and there are additional needs. So just making that connection with somebody who can help you usually opens the doors to lots of resources that you never knew were available.
Yeah. In a chat, and Michelle Mindock talks about Raft is a good resource. Memory Lane TV, Albin. Jan Buchanan says Fairfax County has need-based support. So this is a great opportunity for us to really utilize this platform and getting some other resources out there. So I hope that's helpful. So let's address Laura Heinrich's question, and she says, how do I monitor my own behavior? What signs do I need to be aware of? What are some next steps if I'm concerned? And I don't know if Laura's asking this question on this end, but I will tell you our most popular discussions is the discussion on solo aging. It's people who are concerned about, what if I outlive my spouse? What if my kids are not around? What if I'm growing older and I start to have signs of dementia? How do I know? And what do I do? So any words of wisdom for Laura and others out there?
I think one of the most important things here to start is to open up that conversation, to let the people around you who you do interact with, who do know and care for you, to let them know that you are open to having these conversations. You want to hear from them if they're seeing something happen that concerns them. Have this conversation with your doctor. Don't just go in and get your blood pressure checked and your blood drawn and your weight taken. Ask about your cognitive health. Ask for evaluations. Let people know if you have a concern. Just letting people know that you're willing to talk about it really, really is so helpful. Because so often people become uncomfortable. They're uncomfortable with bringing up, I'm concerned about my sister. She seems more forgetful, but what if I say something to her about it? Is she going to be mad at me? Or the Alzheimer's Association releases a facts and figures report each year, and it just came out earlier this week, the 2022 report. And there's some really interesting information in there about sort of how often doctors diagnose mild cognitive impairment, but don't tell their patient about it, right? Or they suspect mild cognitive impairment, but they don't bring it up in conversation. And so letting people know that you want to talk about it, that you want to be involved in decision making is a really important first step.
Great. And then let's see. There's a couple of other questions here. This is great. Where was the one? Okay. In the Baltimore area, I would like to know about resources in my area. So for the person that asked that question, I want to just let you know, we have a lot of resources that are on the floor when we go back to Floorplan, but there's two that I want you to check out: Inspirations Memory Care and Counterpoint and BCAT. So try to get to those tables if you can. If not, send me an email to steve@proaging.com. I'll provide you with introductions to them and some other resources on memory care in your region. I think a lot of the providers we have on the floor serve Northern Virginia because we've got Insight here speaking today. But Lindsay, as you've said, you answer questions now from people all over the world because everybody can pick up the phone or attend one of your online discussions, correct?
Right. I would just add, because some of you who are listening in may be caring for someone who does not live even in the DC metro area. Maybe your parent is in New York or California or somewhere else. The two places that I send people to look would be eldercare.acl.gov. So that's a place, just Google eldercare, and you'll find that website. And that's a way to find out about resources anywhere around the country, and especially honing in on the Area Agency on Aging. Everywhere around the country has an Area Agency on Aging, and that's where you're going to learn about a lot of the local services. So things like senior centers, adult day programs, Meals on Wheels, transportation, caregiver supports, respite programs. So find the Area Agency on Aging where you are, if you're the caregiver, but also where your loved one is, to find services near them.
Great. Okay, well, I'm going to keep on going down this list, Lindsay.
Yeah.
Again, this audience, these discussions, I just love the questions that you all share with us, and it's much better than me and Lindsay and I giving you a lecture or something. Let's see. Do you support hoarders who have MCI? And again, MCI is mild cognitive impairment. And again, this is a question for Lindsay, but it's also a question for all the providers that are in the audience. So feel free to drop into chat if you've got some solutions. But do you ever encounter hoarders?
Yeah. So, and I want to sort of just at least, I don't know, have everyone think about the difference between hoarding as a dementia-related behavioral change or hoarding as a DSM, diagnosable disorder that has been in place for maybe decades. So yes, people who have a hoarding disorder may also develop mild cognitive impairment or dementia in their later years, and that can complicate things. But sometimes people who are living with dementia might take on some hoarding behaviors, right? Wanting to hold on to things, not wanting to let go of things, letting clutter build up around their house. And because it's more difficult for that person to make decisions, to part with things, to decide what I need, what I don't need, may feel a sense of fear about not having something that they need, especially thinking about those who are sort of our depression era, older adults who, my grandmother held on to every mason jar, every, bar of soap that was just part of how she grew up. So thinking about sort of where this hoarding comes from is an important part of the equation. And yes, there are lots of be helpful when someone is experiencing hoarding. Now at Insight, we are not a residential type of community. People don't live at Insight. They come see us for the day and then they go home. But you may be in a senior living community where you notice one of your residents is hoarding, and talking with family can be a good first step to try to understand the history there. Is this new, or is this something that's been long standing?
Great. Okay, let's see. This is, again, a great question. If you get tested for cognitive decline, can this information be prejudicial if you later want to apply to a life plan community or a CCRC?
So it depends on the CCRC. So life plan communities in this area would be like Goodwin House, the Erickson communities, Ingleside. Those are just a few, and it depends on the community. So if you have a diagnosis or not might mean one thing. If you're taking medications, what stage of the disease you're at, what type of care you need at that time. They may have different contracts that they have you sign where you might pay a different rate than someone who does not have dementia. It may depend if you have like a well spouse that is also moving into the community. So those are questions that just because someone has a diagnosis doesn't mean that you're totally excluded from being able to move into those communities, but it does make things a little bit more particular. So you do want to talk to that community specifically about what's going on. And my recommendation would be not to try to hide it.
Right.
Sometimes I talk with families, especially who are in the earlier stage, and they're sort of thinking, well, maybe I will just not disclose this information. But I really would recommend being honest with the community to make sure that it's a good fit for your family, it's a good fit for the community, and you're going to be set up for success rather than having challenges, shortly after move-in or soon down the road.
And just so you know, there's two on the floor when we go back to the floor, which we're going to try to do here in the next, we'll try to wrap things up a little bit here in the next few minutes, get through some of these questions. But the Virginian and Ingleside has 3 life plan communities, but both of those, so jump on those tables and ask them their thoughts.
Mm-hmm.
But both of those life plan communities have memory care centers. So that's a bonus where people can enter. They don't have to go through the traditional life plan contract, I believe. Okay, this is a good one, and we might go for another hour on this one, but how can you talk about dementia without calling it that? I know you get this question all the time from family members, is how do I talk to my mom about this? Because if I bring it up, she just loses, gets upset.
Yeah. Words have they have meaning to different people for different reasons. And so for me, it's finding the words that are tolerable to the person and are acceptable to the person. Like one of the programs that Insight offers, as well as Loudoun County AAA, is called the SHARE program, where we work directly with one family at a time, the person in the early stage of the disease, along with their primary care partner. And sometimes the word dementia just rubs people the wrong way. Or I've heard the word, the Alzheimer's, that's the A word. And especially if there's been like a family history, someone sort of feared developing Alzheimer's for many, many years and then does get that diagnosis. Professionally, we need to use correct terminology, right? And in the clinical setting with each other and with documentation. But when I'm working directly with a family, especially the person who's living with this disease, I will use whatever words are acceptable to them so that we can keep the conversation going, so that we can get the person into the services that they need. So sometimes we call it forgetfulness. We might call it memory loss. Sometimes we just call it aging. And I don't recommend for all of us to do that because that makes it seem like dementia is a normal part of aging, which it is not. But if that is the word that is acceptable to that person, as you grow older, if you need more help, those are the words that I'm going to use to keep that person engaged in the conversation.
Great. Well, let's do a couple more questions. Then I want you to kind of wrap up with some of the services that are going on at Insight, and then just to let everybody know, Lindsay's got her own office on the floor plan where you can go chat with her in more detail. But I love this question. What is the one thing you wish care partners or those living with Alzheimer's with a recent diagnosis in the early stage would know or ask?
I just wish they would start asking questions sooner. I hear so often, I wish I would have known, 3 years ago when this program would have been helpful for us, or I wish I would have had this conversation with my dad while he was capable of it. So just starting the conversation, making a call to one person, one organization, talking as a family, that would really be like my wish, my words of wisdom as the first step. Just start talking about it. And as far as like, what do you do next when there's a diagnosis and families are so often, you go into the doctor's office, you come out of that neurologist's office with a diagnosis and a prescription for a medication and an appointment set up for a few more months down the road. And then families wonder, what are we supposed to do right now? What do we do in the meantime? And Insight has developed a checklist to help families in that situation. So you've got a new diagnosis. What are you supposed to do next? And so I'm going to type into the chat here that link to a free downloadable checklist. And that does help families kind of with what are those next steps. But it really just starts with starting that conversation.
Yeah. And, all of you who are attending this today are taking the step that Lindsay, like you were brave enough to come to this event on early stage Alzheimer's challenges. The people that we need to reach out to are the ones that are resistant to even hearing anything about changes that might occur as we go through life. And so help get the word out. And when we go back to the floor plan, you're going to have over 100 people that you can connect with. We're all here for the same reason. So let's use this platform to connect with each other. And so I will wrap up with a little bit more information about Insight, but let me just do this question here. And Ashok says, how does one find a healthcare provider that specializes in dementia that can take care of both medical and mental health issues? Is there a website or resource for caregivers? Well, Ashok, at Positive Aging Sourcebook, we're trying our best to sort of consolidate information and host events like this to connect you with the provider community. So I hope that this event today is helpful in that end. But Lindsay, are there any other resources that you kind of find as go-to for people to find providers in their region?
Yeah, I definitely would suggest contacting an organization near you, whether it's Insight or your area agency on aging or a care manager, to find those clinical experts in the field who really understand these types of brain disorders. Even for neurologists, not all neurologists focus on diseases like Alzheimer's. Some focus on migraines or MS or something else. So don't just open the phone book or don't just sort of Google. Talk to somebody and get some recommendations. I know for the Northern Virginia area, we at Insight are always happy to share, kind of a short list of recommendations with families when they're looking for geriatricians, if they're looking for a neuropsychologist, looking for a neurologist, looking for a therapist or a counselor. We're happy to give a few recommendations there. And if you're not in the Northern Virginia area, find that contact that you trust, who's reliable, who's connected in the community, wherever you are, and ask them. Another good place to find good resources is by joining a support group and hearing from other families, hearing from other caregivers. What doctor does their loved one go to, and what do they like about them, and what don't they like about them? What resources have they used? What goes well? What's been a challenge? And learn from each other.
So, okay. So I'm going to hit you with this last question, but that leads you up to telling us a little bit about Insight, and then we're going to go back to floor plan, folks. And you don't want to miss that because we got over 100 people here that you can connect with. So can you recommend any virtual programs for those with MCI, which again is mild cognitive impairment, other than Insight's reconnection program? So somebody gave you a softball there, Lindsay. What is the Reconnections program? And then tell us about some of the other programs at Insight.
Okay. So Reconnections is a program specifically for people with mild cognitive impairment, kind of anybody who's in that area, whether it's affecting daily life or not quite yet, but still experiencing noticeable memory loss or other types of cognitive changes. And Reconnections is a social engagement brain health program. It is not a healthcare program. The doors are not locked. There's no nursing staff on site. It's rec therapists who are leading 5 hours worth of activities built around the people who come that day. And it's all about making connections. It's about making people feel a sense of purpose. It's about providing movement and cognitive stimulation and music and just having a place for people to go where they feel like they're important, where they feel connected and a sense of purpose, and that they're not being judged. They're among their peers, right? People in the early stage, like in the Reconnections program, are still very socially capable, right? They're making conversation with their neighbors. They're independent with using the bathroom. They don't need medications while they're there. They're feeding themselves. They're able to participate in lectures and word games and exercises and all different sorts of programs throughout the day. So Reconnections is a great option for in-person programming if you're near Fairfax, Sterling, or Alexandria. And then there also is a virtual option for Reconnections that's 1 hour long, 3 times a week. So it's on Zoom and it's, again, interactive. So when you think about things on the computer, you know, a lot of people know about Lumosity or other kinds of brain games on the computer, and there really isn't research showing that those are effective, that sort of carrying over doing those brain games on the computer has any effect on cognition in everyday life. You might get really good at that game on the computer, but that doesn't necessarily mean that you can continue that process of making dinner and all the steps that it involves. So Reconnections is a great option to be connected, to have that sense of purpose and stimulation. But there are a few other programs in the area too. Last I knew anyway, unless it's changed, Kensington Club in Rockville, Maryland had a virtual option for their program. And then there are memory cafes. So these are more of like a once a month, twice a month type of program for families. They're not an enrolled program, but memory cafes can be a really great opportunity for couples or families to meet other couples and families and do something fun together just for an hour or two, once or twice a month. And memory cafes are free of charge. So those are great resources to look into as well.
I love it. All right. So any final closing information that you want people to know about Insight? There's a table for you on the, actually, let me pull the floor plan up before we head back there. And while I do that, any additional information you want to share about Insight, and then folks can connect with you in your virtual office. They can also go to the first table, and there's some Insight memory care team members there.
Yes. So please come talk to me, go to the Insight table and talk to some of my fabulous colleagues there and ask your questions. But Insight really is our goal is to serve people throughout the entire span of these brain diseases. So from not even yet diagnosed and having all these questions as a family member, who should we talk to? What doctor should we go to? What do we do next? All the way through end of life. And one of the things we've really been focusing on over this past couple of years and moving forward are building our early stage programs. And there are so few early stage programs in the DC metro area and around the country. There is a huge gap in services there. And so Insight is trying to fill that gap and to serve more families in the early stage of the disease. So please, feel free to, if you're a professional, tell your families about us. If you're a family member who's attending today, check out our website, give us a call, and we're happy to talk with you to see how we can support you and your family.
Okay, great. Well, okay. Thank you, Lindsay. Don't leave yet. You'll just we're going to all pop off the screen and go back to floor plan. But before we do, I want to kind of, especially for those that joined late, I want to give you an overview of the next part of this event and what you'll experience. Okay. So right now we're in presentation mode. We're going to go to floor plan mode, which looks like my screen that's on there. Now, you'll notice on the bottom of your screen, you've got a cam on and a mic on button. When you're at a table, make sure that your camera and your mic is on. That way you can communicate with the people at the table. Now, you see on the floor plan here, we've got a bunch of resources for you, memory care resources. The Insight Memory Care and Lindsay over in the office to the left. We've got Friends Club, which is in Montgomery County, and it's got some similarities to the Insight program. So definitely check out Friends Club and learn about what they're offering. We have a bunch of housing providers that are on the floor, but before I talk about them, I want to bring up a really amazing service that's out there. It's called Counterpoint and BCAT, and it's a program that can help evaluate your loved one's condition as well as the question about how do you maintain brain health. Talk to the folks at Counterpoint and BCAT. But we have some memory care housing providers: Silverado, the Virginian, Potomac Place, Tall Oaks, Charles E. Smith, Ingleside, Great Falls, the Providence, Arbor Terrace, Rembrandt, Inspiration Memory Care, and I'm sure there's others that are on the floor just networking. So we're going to leave this conference room open for you till about 1:30, and then it'll just automatically shut. So feel free to just go and network and meet people and share resources and give me feedback. Also, I'm recording this discussion. I'll also download the chat. So there's a lot of chat going on there. That'll be all available. I'll send an email out when it's online so you could share this and go tap into chat. But email me with your thoughts on this format. I hope you like it, and I hope everybody makes a connection, because that's what we're trying to do here, is just connect the members of our community, the providers, the families, and the older adults, connect you all together. And I hope this helps move in that direction. So Lindsay, thanks again. And we're going to go back to floor plan, and everybody have a great afternoon and a great weekend. And there we go. Yes. Oops. I'm trying. Okay, what happened here? Oh boy.